Hi, I'm Dr. Gus at Advanced Health and Wellness Centers. We have a wellness clinic where we see people with chronic health conditions most of the time. So today I would like to take an attempt to demonstrate a little bit about what we're talking about and how we came into believing in ionized water and to give credence and validation a little bit to this unit and to this concept for health. And we're going to take a patient here, a good friend of ours, Sue, who really has never gone through our clinic. So this is really good because she's utilized her own methods for health and not really partaking in any concepts we've done. So it'll be a nice pure supply of blood to see her level of health at this point. And then what I would like to do is give her regular bottled water, and then the Tient ionized alkaline water, and really measure, we'll time it and measure the effects 1 minute and 5 minutes after drinking it, and see if we see any changes within her blood. So it'll be 3 different tests. One will be the baseline, and then one with regular bottled water, and then one with the Tient ionized alkaline water.
I consider myself to be a very healthy person. I do intense yoga 3 times a week, sometimes 4. I eat healthy, all organics, grass-fed meats, and just keep very busy. So I expect that my blood work is going to come out just fine today.
One of the things we're seeing here is that the whole screen, when you take a snapshot, you see around 700 red blood cells to a white blood cell. You're a little short on your red blood cell count. You're definitely having no movement at all. Very little motion. There was a little sunlight in the beginning. Now obviously outside the body, it's going to react a little different, but we've seen thousands of these, so we know it should move for quite a while outside the body if it was normally ionized. The other thing I'm seeing is there is not a lot of white glow in these cells. And I'm going to change the phase so we're able to see better. But right here, the membrane is collapsing and breaking. And I could see it on several ones. It'll show better on this next screen. There isn't uniformity. Some seem bigger than others, it's bigger and that's a little smaller and smaller. The other thing is the membrane is jaggedy, which is it's unhealthy, versus nice and round. We're seeing a lot of debris and things that shouldn't be in there. Okay, and definitely no energy in your cells. No, that white glow is not in there. And we can scan. I mean, this has been outside your body now for 3-4 minutes. But the white glow should be in some of your cells. And we're seeing nothing.
I was shocked to see my first blood analysis. My blood basically wasn't moving at all. It was very, very shocking.
Okay, now we're going to do the second test. You drank that bottle of water. It's been roughly 5 minutes. Okay, so we're going to go through the same process. I'm going to get the same finger, a different spot. And we're going to look under the microscope and see if we have any changes. So I expect your body to change quickly because of so many good things you do, but being dehydrated, you see you clump up, but you got movement to start happening from just putting water in.
Yeah.
And in our opinion, without the charge, it's not going to do as good of a job. But we'll see in the next following test. Okay. But you will see that you got some more movement now. So hydration, key to your health. Being out of the body, obviously, it's not going to be as happy as in the body. But at the same time, it should have this continuous waterfall type of flow. I mean, over a minute. And then, as time subsides, it should just go into the steady flow, like what you're seeing, for, it can be hours.
After drinking bottled water, it did improve the flow a little bit, but then there was clumping of my red blood cells, which was a bit unsettling.
Just drank ionized alkaline water, and it's been in your system roughly 5 minutes. Okay, so let's see how much more the hydration works and if the ionized water looks any different than the bottled water. See, the body has this untapped potential to really change quickly when you do the right things.
Yeah.
But universally, everybody needs water and oxygen as a starting point in order to, recover their health and balance their body. So, if we were to go to the other screen, now we see a ton of white.
Yeah.
And movement. And what a difference. What a difference 10 minutes makes.
Yeah.
Yeah. So, one of the questions usually is, well, does ionized water raise oxygen? If what we're looking at here is oxygen, obviously, like I said, that mobility, opening the potential of the membrane to take in air, it seems like it increases it. It's not that it's increasing the total, I don't think, volume coming in, but it's allowing the red blood cell to carry more.
Yeah.
I think that's where the increase is happening, but that's just an opinion at this point.
After seeing these 3 blood analysis tests come back today and the effects that the Tyiant ionized water had on my blood circulation and flow and non-clumping of my blood, I am very convinced that it is a beneficial thing that I need in my life.